In our service, we see children with all of the problems that any child might have within mental health, but specifically children with learning disabilities. So the original term for learning disabilities was mental handicap, which we don't use anymore, but all children have a global intellectual delay and need additional support to achieve what is expected for any child in our society. Well, our service is one of the few national and specialist services for children with learning disabilities and behavioural or mental health problems. And we have a wide-ranging expertise in the complexities of mental health associated with learning disabilities. We also adhere to an evidence base, so we do research, we do audit, we link in with the learning disabilities and the mental health networks to ensure that we provide a really high quality but comprehensive service. The understanding about the underlying causes is a combined effect of biological, psychological and social factors. So, for example, in young people with learning disability, we know there's increased risk of having a genetic disorder, and as part of that genetic disorder, then a risk of developing certain mental health problems. We know that people might have a genetic loading for developing a learning disability, and we also know that certain syndromes will predispose to a learning disability. Also, children who at a very young age might have a head injury or serious damage to their brain will have an intellectual disability. We know that certain disorders are more common in certain genders. So, for example, we know that autism is more common in boys than in girls. Other disorders, for example, Fragile X syndrome, can occur in boys and girls. Stigma in the field of learning disability and mental health has always been a concern and an issue. I think with early education within schools and inclusion, some of this stigma can be reduced. So, for example, we do go into schools and teach teenagers about mental health problems. When families are seen by our service, what we hope is to help improve the child's behaviour and reduce the mental health problems that they're experiencing. What isn't feasible at the moment is to cure the learning disability. There is not the science available at the moment to cure learning disability. So we help parents to understand about their child's disability, but also help them to understand that we want to improve behavioural difficulties whilst recognising the way the child is likely to behave. If a family or parent is worried about their child who has a learning disability, the first point of contact is the child's general practitioner or the school nurse or the school doctor, or if a paediatrician is involved, talk to them. The next phase would be to consider referring the child to the local child and adolescent mental health service. Sometimes there's services within paediatrics for younger children that deal with, for example, autism or other difficulties like that. In other areas, it might be the local child psychiatry service that picks that up. That local service will then decide, in discussion with the family, whether a more specialist assessment is needed, and then that referral would be passed up to our service. Saying that, we're always happy to receive phone calls from families and parents. Parents can ring in and ask to speak to me, and I will return calls in order to help parents understand the route and where they can go to for help. Our service doesn't have a specific helpline, but we have a team administrator who will point the inquiry in the right direction, and his number is available on the SLAM website, or you can call 0203 228 2570 and ask to speak to Roland.